Good morning, all. Um, our study was on the clinical applications of the ultraviolet angiography. Ultraviolet angiography is a cutting-edge imaging techniques which captures the detailed images of the retina, particularly the peripheral regions, which are often missed by the conventional imaging methods. The ultraviolet consists of an ellipsoidal or parabolic mirror, which gives a wide scanning angle even without the pupillary dilatation. Unlike the traditional angiography method, which covers only 45 degree to 100 degrees of field of view, ultraviolet field gives an field of view up to 200 degrees, which covers up approximately 875 millimeter square of the retinal area. This is an ETDR standard 7 field. ETDR standard 7 field, which consists of a 30 degree circle which extends horizontally 70 degree and 75 degree vertically. And this is an ultraviolet field image showing the different parts of the retina, posterior and mid periphery and far periphery in a single shot. Our aim was to evaluate the clinical applications of the ultraviolet field and in the detection and management of various retinal pathologies, and to compare the ultraviolet field with a conventional angiography. It was a retrospective analysis of 69 IC35 patients and compare with the ultraviolet field and conventional angiography. The study period was of 11-month study period. The pathologies studied were retinal vascular pathologies. The common parameters we have included is the ischemic changes in the central mid-periphery and neovascularization in the posterior pole and mid-periphery, and peripheral vascular leakage and disc leak and vascular stasis. Coming to the result, the detection of the retinal ischemia, the ultraviolet field had a higher hand in both the mid-peripheral and peripheral region, and the sensitivity and negative predictive value was 100% for the ultraviolet field, and the specificity and positive predictive value varied differently in the mid-peripherally. Ultraviolet field can also calculate the ischemic index. It is the percentage of the ischemia of the total retinal area. The pixels contained in the non-perfused area are calculated and divided by the number of the pixels on the whole retinal surface area. It is important because it can differentiate between ischemic versus non-ischemic CRVO, and in recalcitrant diabetic macular edema, ISA will be high. Coming to the detection of neovascularization in the periphery is easily missed by the conventional angiography methods, which is easily picked up by the ultraviolet field. The detection rate was for ultraviolet field was about 5 times higher than the conventional angiography. The sensitivity and negative predictive value was 100% for the detection for ultraviolet field for the detection of the neovascularization. The specificity was also high, and the positive predictive value slightly differed in the mid-peripheral region. And coming to the peripheral vascular leakage, it was a leakage from the retinal vessels seen as hyperfluorescence extending beyond the vessel wall, occurring in the setting of active retinopathy. PVL has been linked to peripheral non-perfusion and neovascularization. Coming to the detection of PVL, the ultraviolet field had excellent ability to detect the PVL, whereas the conventional angiography failed to detect any of them. The disc leak was detected by both the conventional and ultraviolet field in a similar manner, and the negative predictive value for all the three clinical conditions were high for the ultraviolet field. Summary of our result: ultraviolet field had a higher hand for detection of ischemia, neovascularization, PVL, and vascular stasis, especially in the peripheral regions, and sensitivity and negative predictive value was 100% for all the conditions, suggesting its excellent ability to rule out negative results. PPV positive predictive value was varied for all the conditions except the disc leak, which suggests some false positive result may present in lesser extent. The accuracy and positive likelihood ratio was also suggestive of ultraviolet field's excellent ability to detect pathologies, especially in the peripheral regions. The similar studies by the Bessel et al., Patel et al., and Silver et al., and Tox et al. Extensively corroborated with our study, suggesting the ultraviolet field capability to detect retinal non-perfusion, vascular leakage, and neovascularization in the peripheral retina, and ultraviolet field's ability to detect peripheral vascular pathology in various retinal diseases, and it's higher hand in the than the ETDR standard 7 field imaging, and it also helped in changing the management decision in a significant proportion of cases. Coming to the usefulness of ultraviolet field, it can capture up to 3.9 times more area of retinal non-perfusion, and 3.2 times more retinal surface area, and 3.8 times more laser pan-retinal photocoagulation treated area, and it can it captured about 10% more pathology and also modified diagnosis and management in about 45.7% of our cases. It's an indicator for the predicting diabetic retinopathy severity worsening. Thus, it predicts the progression of non-proliferative diabetic retinopathy, and it also assesses the general disease commonality by assessing perfusion status, and helps in detecting the diabetic macular edema and ischemic area higher hand. Then it also reduces the area and intensity of the treatment with laser, because it can capture the peripheral ischemia as well, and the montage artifacts of the ultraviolet field is less, and it also recruits more proliferative diabetic retinopathy cases. Thus, ultraviolet field helps in identify more treatment-worthy diseases which are often missed by the conventional angiography and increases the clinical outcome in patients. These are my references. Thank you.
Thank you. Nice.